Good evening, everyone. This is Pradeep, Ambassador of Change from GETI, the Global Education and Training Institute of Lucknow. We are the premier training institute in India for the principals and the teachers. And we have many pre-service and in-service programs. And for more information on this, please go to 740-840-1000. Right now, you are on our disruptive education platform provided to us by our mentor, Dr. Sunita Gandhi. And on this platform, we have interacted with more than 1,100 educators from India and all over the world. And this evening, we have for you Mrs. Veena Purwar. She's the principal of the Versatile Scholars School in Lucknow, UP. And she has many aspects to her credit. She is an individual passionate about life. She is the CEO Director of Education Partners in India, Director for State Wellness Program, Regional Coordinator for Olympiad with Unifed Council. Well-versed and highly skilled industry experience she has, and she is a master trainer for memory techniques with UCMAS, certified trainer for QMath, group partner with the Teacher Foundation, and has been honored with various awards for introducing innovative ideas in classrooms. Welcome, ma'am. We're very happy to have you. And she will be speaking on health education post-COVID. So thank you, ma'am, and over to you.
Thank you so much. A very good afternoon to everyone. Now, post-COVID, when we say, right, and I'm really thankful to the entire team of GETI for the support they extend, and a very good platform by Sunita Gandhi, where she chooses the topics very nicely and would like to ask the people, and we are asked to speak on various topics which again not only are life skills for the children or the soft skills and exactly what they are. It helps us on this platform to explore, to express our views with everyone, with the audience and the entire team. So saying that, when we come to health, post-COVID health is a very big issue which is being faced with with every person. Not only the parents, the children, the grandparents, the entire family and the entire society is affected by health issues these days. As we say, humans are a social animal, and we were bound for entire 2 years, we should say, at home, working from home, doing family. Earlier, in the early days, it was very easy for us, and we enjoyed the break from the work. No going to the work offices, children not going to school. The Facebook pages were uploaded with beautiful pictures of different variety of cuisine coming from every kitchen. Even I did so, right? But after a certain period, when you are there together for almost 24 hours into the house, sharing the same platform, it becomes very difficult. Health, when we say, it is not only the physical, it is mental health, emotional health, all the health, gets started affected. How you communicate, how you get up, how you walk, everything, every little soft skill of your life is affected to it. So let us find out today, what is health? How does it include the physical, the social, the communication, and the education of not only children, but we as adults also. So we will be finding out in this process what are the different essential skills we need and how can we do it, right? We can do it by creating and maintaining healthy lifestyle. But what do we say? How do we create and maintain a healthy lifestyle? right? It says very easy. Is getting up early in the morning, having brushes, and doing your complete routine, is it creating a healthy lifestyle? What are the different practices? What are the different practices we apply to improve our relationships between the members in the family? When we say apply and practice, act in healthy ways, and atmosphere which is very pleasant, happy, just ignoring, okay, don't say this to the parents, don't say this to the children. Parents often said कि बच्चों को डांटना नहीं. Is that only creating a healthy atmosphere at home? So we will be exploring today all these things. What is a social environment? बच्चे घर से बाहर नहीं निकल सकते मैम, बच्चे बहुत चिड़चिड़े हो गए हैं. In the school when they come we feel अरे बच्चे बिल्कुल सुनना नहीं चाहते टीचर का. They don't want to sit into the classroom for long 3 hours, 4 hours. So how do we create that atmosphere? Let us understand what is health-based education. Now, when we say understand, we need the plan, we need to understand the goals, what will be our objectives, and what knowledge should be given to the children so that we can see the necessary changes in the children, and what are the conditions which we should give to the children in the school. When you give certain conditions, when you provide those things, the children are ready to move with you. What are the different methods? Communication. We say allow the children to communicate as much as they want. But communication, what does communication? Verbal communication, when we tell the children to speak their minds. Do the children actually understand what are they saying and how are they saying? The youth behaviors, the experiences they have, the health behaviors which they experience. So they have to be given the right words to speak. We need to have a continued, you should say, a continuous observation in the child's behavior, how they behave, how they speak, and what is the circumstances which they correspond to, right? And before we plan out anything, we should be very, very particular to understand that this education to be imparted by qualified teachers who connect with the students in such a way where they make them aware of the health services, what are required with them, how to engage with the parents, what kind of foods the children should have. You should partner with the community and make them understand the importance. What is the importance of the food which they take? Only then the child is ready to move with us, right? Early adolescence, when the child moves to the early adolescence, there are there is a pressure in the child. He is into a dilemma that he doesn't understand his body, he does not understand friends, he does not understand other children, and that is the time he needs proper guidance. And what are the health topics we pick up? In the science, you teach the children different various topics. Food is taken, which foods give you vitamins, which gives you proteins, which will give you everything, what is a complete meal. But do we actually take care to make them understand why a complete meal has to be taken? Right? So health topics, whenever we are introduced in the school, it is very necessary that with that you not only explain to them the nutrients present in the food, but why this nutrient is important for the child. because every nutrient, not only physically but mentally, it also affects. Some food, when you give the child, it aggravates their anger. Sometimes it gives them such an energy that it becomes very difficult for the child to sit down, right? But these food, at the same time, they protect from the threats which the children can face. It builds a positive behavior in them and builds the competitiveness, which the child, when sent on the ground to play, the child does not feel the tiredness. So, what are the healthy nutrients? You should always encourage them to understand what are the healthy nutrients and the health topics to be taken, so that the awareness, and it should be explained, communicated in such a way that the children, some schools have clubs which help the children to prepare food in school, cooking without fire, various competitions. So that is a very good initiative where you make them in hand. Let the children experience that. As the child moves from primary to middle school to high school and he moves into adolescence, it is basically necessary to give them the right knowledge on sexual and reproductive health. You see, the children, very young children, have peer pressures, different pressures, and are unable to cope up with that. We have a very good national sex education system which outlines very beautifully the foundation knowledge which the children have to be given. And it is focused around the age group, which we cater to in the schools. The students can learn at every level with the curriculum, the learning objectives for the physical benefit, and how they can keep themselves protected. Now, what are these sexual diseases which we need for the children to make them understand? The HIVs, then unintended pregnancies for the girls. The youth are facing huge risk of this. So, we as educators in school, health is our prior concern, and we should design a curriculum in such a way that where we can help our children to understand the various programs, the different food they have, and how they can improve not only their health but their academic performances also. So when we say after that, some of the children, if you tell them, you find the children eating chalks in the class, just rubbing on the parapet of the board and trying to have the chalk or sand. So we should always make the children aware of the different ailments, worm infections. We have the shops, we have the small shops in front of the school, that people standing selling out things. When we say, we should take care that whatever the food the child is consuming, they may be affected by different worms. So, what are the worms and how do you identify the different ailments? Some the children complain of the stomach ache in the school too many times. It is not only the gastric problem because the children do not have food in the morning. They do not have a breakfast. They skip their breakfast and come to the school early in the morning without having milk or something like toast or some bread. And then they may complain about the pains. But stomach ache is not a symbol of always gastric problem. They may be having a severe worm infection. Deworming is very important and our government does it. So it's very necessary for us to encourage the deworming program when we are approached by the people in the school. We should welcome them, have the small kids dewormed, and make them aware why they should cut their nails, keep their nails clean. While eating your lunch, always wash your hands. So deworming is one of the very important aspects. And the food whichever we have, basically not, it is like the children say, हम पिज्जा क्यों नहीं खा सकते, बर्गर क्यों नहीं खा सकते. The environment which we stay, that we should say the climatic conditions we see in India, all 3-4 climatic हम देखते हैं, summers, winters, rainy. So the way we stay, the food habits are directly connected with the surroundings, the environment. The food we eat also aggravates violence in our body. That is why whatever food which we consume, and with the food we should always teach the children how we can prevent violence and allow the children to have peace education. Now when I say you should plan everything, what are the different methods for the health education? You can plan participatory methods. Like we said, first is we have the different clubs where the children prepare food. Second, how you could do is you could plan one day that today, okay, today we will have fruit days in the school. Make it a fruit compulsory, where we say midday meal. We should make a fruit break compulsory in the school, where we encourage the children to have fruits according to the season. I don't say कि अभी गर्मी है तो तरबूज आप भेज दीजिए स्कूल में. No, तरबूज आप कैसे भेज सकते हैं? But yes, you can slice them up nicely. You can send them mangoes. And we are blessed to stay in a country where, according to the seasons, we get the different fruits, and these fruits are very rich. We could replicate natural processes. Like I have been associated with a group, Rich Kalyanam, and under that category, we went to various schools. We planted fruit trees so that into the next coming 3 to 4 years, these plants could give fruits, and the school people could, provide fruits to the children. And the school have made small groups of a senior class, junior class, where the children take care, of these plants. When you see the plant growing yourself, taking care of the plants, उस पेड़ के फल खाने का मजा ही कुछ और होता है, right? And when you let them take the decision how to take care. So you're not only teaching them care of environment, to have healthy food, you allow them to take decision how to take the care, who will take the care of the plant. You teach them to cope up. If your plant is affected, apply your science how to take care of the plants. If the worms are there, if the plant is dying, are you watering it more? Is it getting proper sunlight? So physical health or health issues, when we say, it is not related only to a particular person, but it is the education which we are giving. You make it a process to replicate naturally. Right? The other topics which we say, today the beer shops, wine shops, earlier they were not allowed into the social, whether they were communities, societies living. But these days you can find these shops, and children are becoming very, very, very attracted day by day to these shops. Earlier they would collect the money and go and buy a cold drink bottle. Now they say, chalo, beer ki bottle lete hain. We have to teach the children. We as educators, the school, it's a role of the school to make the children understand to say no to alcohols, tobaccos, and the drugs. We have to be modeling our behavior in front of the children where we can teach them a healthy lifestyle. We have to be very observant. And we are blessed. We are living in a time period where social interactions have become very easy. I am today associated with you to the social media, online media. So we should try to put up social campaigns. We should put social interactions, and these all activities can be conducted in a very safe atmosphere into the class. You don't need to rush here, you don't need to rush there to make this all the awareness in the children. You could infuse them with the different subjects, whatever the knowledge they have gained up to the class which they are studying. Make it an attitude that you link it every time to the previous knowledge or whatever has been taught to them. But sometimes, even after we find that we are not able to get through. So we need to take a step back, think why we are not able to convey this to our children. Why is it a failure for us that we don't reach the people and children and we are not able to tell them why health is the priority? With that, I would say that health education for the children, it is very, very important. Physical fitness, when we say, it's not only playing into the ground for the longer hours, that the child is playing for long hours, running into and then he feels tired. We have to see that the child, whatever has sweated out, is able to overcome the deficiency in his body. Oops. Hello? Sir, am I? Hello? Okay.
Yes, ma'am.
Hello? Sir, my camera lights have gone.
Yes,
Am I
ma'am.
audible? Okay, sir. Thank you.
Yes, you're audible and you're visible.
Okay, thank you, sir.
Okay, ma'am. Carry on.
Right. Yes, sir. Now it is important we need to make all the a curriculum or the academic whatever we plan in such a way that as early as possible we are able to develop the positive and a healthy outcome in the children. Right, sir? With that, I hand over to Pradeep, sir. Hello? That's it, sir. How much time do we have?
Yes, thank you, ma'am.
Right, thank you, sir. Thank you so much.
No, that's perfectly all right. You want to carry on, you can carry on.
No, sir. I'm done with this thing.
Okay. Thank you.
Right.
Thank you.
Thank you so much.
So, yeah. So we thank you, ma'am, for that talk, which I am sure will be very grateful, very greatly helpful to whoever is going to listen to it, and something which is the requirement of the time. So, good evening, everyone. And before we leave, I request you to watch our Detox Disruptive Literacy Movement by Global Dream, which is an initiative by Dr. Sunita Gandhi since 2014. The whole idea is to ensure everyone's participation in helping India achieve total literacy by a people's movement. So everyone's heard of each one teach one. We expect those of us who can teach more than one to do that and to ensure foundational literacy and numeracy. In this, we have many talks every day. And for talks that you would like to listen to, please contact 740-840-1000. So thank you, everybody. Good evening, and see you again on the 16th. Tomorrow and day after will be holidays. See you again on the 16th. And thank you so much, ma'am, for that
Thank you so much,
excellent
sir.
talk on
Healthy living.
education post-COVID.
Right. Thank you, sir.
Thank you, ma'am.